In this video, we are going to discuss 20 important questions for JIPMER Nursing Officer Exams 2019. Welcome to SAT2 Career 2.0 Online Nursing channel. Before going to today's lecture, please subscribe to SAT2 Career 2.0 Online Nursing channel if you have not yet subscribed. Also, click the bell icon to get the latest notification about our new videos. Let's see the first question of this video. Which of the following medical conditions has a similar signs and symptoms as those in a major depressive episode? Option A, pancreatitis, B, cholecystitis, C, tuberculosis, D, hypothyroidism. So which medical condition is similar to that of signs and symptoms of major depressive episode? The right answer is option D, hypothyroidism. The rationale: among these four conditions, the hypothyroidism signs and symptoms look similar to major depression, which includes changes in weight, sleep disturbances, and loss of energy along with thinking retardation. We know very well in major depressive episode, patient weight loss, have lack of sleep, and patient also have loss in energy. As a result, these symptoms is looking similar with the hypothyroidism. Also, thinking retardation will be present in both conditions. Let's see the second question. Your patient has a problem with health maintenance associated with sleep disturbance. Which area of nursing care do you need to assess? Option A, potential for false and security. Option B, harm to self and serum iron deficiency test. Option C, spiritual distress and deferred psoriasis. Option D, activities of daily living and diet. The right answer, before seeing right answer, just see the question again. Health maintenance related problem associated with sleep disturbances present. So which area nursing care gets the priority and which one should be assessed by the nurse? The right answer is option B, activities of daily living and diet should be assessed. The rationale: nursing care of patient related to health maintenance for sleep disturbances include assessment of activities of daily living, diet, medications, etc. Question number 3. While assessing your patient, surgeon for chronic grief, what physical disturbances would indicate the patient is in chronic grief? Option A, anxiety and sinus pain. B, cardiovascular and gastrointestinal problems. C is amnesia and overeating. D, visual cloudiness and bilateral leg pain. Surgeon is in chronic grief. The physical disturbances associated with this psychological problem will be option B, cardiovascular and gastrointestinal problems. The rationale: patient with chronic grief will have signs and symptoms related to gastrointestinal and cardiovascular disturbances. The following signs and symptoms will be associated, such as anorexia, dry mouth. These are related to GI, tightness of chest, and other GI disturbances also will be present. Question number 4. Raju experienced alcohol withdrawal syndrome and now admits he needs help. Which of the following is the most appropriate resource to which you should direct the patient? Option A, Reach to Recovery. B, Alcoholic Anonymous. C, Depression Support Group. And D is Suicide Support Group. So here patient wants help. He is a alcoholic and he has withdrawal syndrome. So where the nurse should send him? Right answer is to Alcoholic Anonymous. The rationale: the most appropriate supportive resource for alcoholism is Alcoholic Anonymous, although depression may or may not be involved in the case. Question number 5. A client diagnosed with pneumonia reports a decreased sense of taste that has greatly affected the motivation to eat and drink. Which intervention should the nurse implement to help increase the client's appetite? Option A. Offer in between meals and snack. B. Provide 3 large meals daily. Option C. Provide mouth care before meals. Option D. Offer to sit with the client during meals. So here client is having pneumonia, and because of this the client taste sensation has decreased, and this motivated the client not to eat and drink. Which intervention is given by the nurse will implement the action of patient to increase the client's appetite? The right answer is option C. Provide mouth care before meals. The rationale: client with pneumonia experiences decreased taste sensation as a result of sputum expectoration. In pneumonia, sputum expectoration is more, and to minimize this adverse effect, the nurse should provide mouth care before every meals. Client also should eat small and frequent meal because of the dyspnea. Question number 6. The nurse is preparing to administer an opioid to a client via an epidural catheter. Before administering the medication, the nurse aspirates and obtains 5 ml of clear fluid. Based on this finding, which action should the nurse take? Option A. Inject the opioid slowly. B. Notify the anesthesiologist. C. Inject the aspirate back into the catheter and administer the opioid. C. Flush the catheter with 6 ml of sterile water before injecting the opioid. So, the nurse is preparing to administer opioid for a client via epidural catheter. Before administering the medication, the nurse found the aspiration amount of fluid was 5 ml. It is a clear fluid. And based on this finding, the nurse action should be option B. Notify the anesthesiologist. The rationale is aspiration of clear fluid of 1 ml indicates the epidural catheter is in correct place. If more than 1 ml of clear fluid or bloody return indicates the catheter may be placed in subarachnoid space or any vessels. Therefore, the nurse should not inject the medication and must notify the physician immediately. Question number 7. The nurse prepares to assess a client who is in the second trimester of pregnancy. When measuring the fundal height, what should the nurse expect to note with this measurement regarding gestational age? Option A. It is less than gestational age. B. It correlates with gestational age. C. It is greater than gestational age. And D. It has no correlation with gestational age. OBG related question. So, client is in second trimester of pregnancy. While measuring the fundal height, what nurse should expect related to the gestational age? The nurse should expect that the fundal height correlates with gestational age. Option B is right. The rationale: until the third trimester, the measurement of fundal height will on average correlate with the gestational age. Therefore, other 3 options are incorrect. Question number 8. To ensure client safety, which assessment is most important for the nurse to make before advancing a client from liquid to solid food? Option A. Bowel sounds. B. Chewing ability. C. Current appetite. D. Food preferences. We all know very well. So before proceeding the uh, diet, liquid diet to solid food, the nurse should check for client's chewing ability. Also, vowel sound also very important. Once the vowel sound is here, then only we are starting the liquid food. So here it not get the priority. Chewing ability gets the priority. The rationale: nurse needs to assess the client's chewing ability before advancing a client from liquid to solid food. It may be necessary to modify the client's diet to a soft or mechanical chopped diet if the client has difficulty chewing because of the risk of aspiration. Vowel sound should be present before introducing the diet, including liquids. Now, ninth question. The nurse is performing an otoscopic examination on a client with suspected diagnosis of mastoiditis. Which finding should the nurse expect to know if this disorder was present? Option A dull red tympanic membrane, B, a mobile tympanic membrane, C, a transparent tympanic membrane, and D, a purely colored tympanic membrane. So, when a nurse is going to perform otoscopic examination for a client suspected with mastoiditis, sorry, the nurse should expect the finding of a dull red tympanic membrane. The rational otoscopic examination of a client with mastoiditis reveals a red, dull, thick, and immobile tympanic membrane with or without perforation. Option 2, 3, and 4 indicate normal finding in an otoscopic examination. Now, let's see the 10th question. A postterm infant delivered vaginally is exhibiting tachypnea, grunting, retractions, and nasal flaring. The nurse interprets that these assessment findings are indicative of which condition? Option A, hypoglycemia, B, respiratory distress syndrome, D, meconium aspiration syndrome, and D, transient tachypnea of the newborn. So here, postterm infant delivered vaginally exhibiting the symptoms like tachypnea, grunting, retraction, nasal flaring. The nursing assessment finding indicates this is due to the option B, option C, meconium aspiration. So here everybody have a choice for writing respiratory distress syndrome, but respiratory distress syndrome will not be the right answer when there is meconium aspiration syndrome. The rationale tachypnea, grunting, retraction, and nasal flaring are symptoms of respiratory distress related to meconium aspiration. Meconium aspiration occurs often in postterm infants and develops when meconium in the amniotic fluid enters the lungs during fetal life at birth. Hypoglycemia are irrelevant. Transient tachypnea of the newborn is primarily found in infants delivered via cesarean section. Respiratory distress syndrome is a complication of preterm infant. Question number 11. The nurse is preparing to initiate an intravenous nitroglycerin drip on a client who has experienced an acute myocardial infarction. In the absence of an invasive arterial monitoring line, the nurse prepares to have which piece of equipment for use at the bedside to help assure the client's safety. Option A, defibrillator, B, pulse oximeter, C, central venous pressure tray, and D is non-invasive blood pressure monitor. So here nitroglycerin is administered intravenously for the client who has acute myocardial infarction, but there is no invasive arterial monitoring line. At this time, the nurse should keep option D, non-invasive blood pressure monitor at bedside. The rationale, nitroglycerin dilates arteries and veins (vasodilator), causing peripheral blood pooling, thus reducing preload, afterload, and myocardial workload. This action accounts for the primary side effect of nitroglycerin, which is hypotension. In the absence of arterial monitoring line, the nurse should have a non-invasive blood pressure monitor for use at the bedside. Question number 12. Your patient returns from the operating room after abdominal aortic aneurysm repair. Which symptom is a sign of acute renal failure? Option A, anuria, B, diarrhea, C, oliguria, D, vomiting. So, a client who comes from abdominal aortic aneurysm repair from from the operation theater, the symptom of oliguria indicates acute renal failure. The rationale: acute kidney failure occurs when your kidney suddenly becomes unable to filter waste products from your blood. When your kidney loses their filtering capacity, dangerous levels of waste may accumulate and your blood chemical makeup may get out of balance. Urine output less than 50 ml in 24 hours signifies oliguria, an early sign of renal failure. Anuria is uncommon except in obstructive renal disorders. Question number 13. Which causes of hypertension is the most common in acute renal failure? Option A, pulmonary edema, B, hyperolemia, C, hypovolemia, D, anemia. The common cause of hypertension in acute renal failure will be option B, hypervolemia. The rationale: acute renal failure causes hypervolemia as a result of overexpansion of extracellular fluid and plasma volume with the hypersecretion of renin. Therefore, hypervolemia causes hypertension. Question number 14. A patient returns from surgery with an indwelling catheter in place and empty. 6 hours later, the volume is 120 ml. The drainage system has no obstruction. Which intervention has priority? Option A, give 500 ml of bolus isotonic saline. Option B, evaluate patient circulation and vital signs. C, flush the urinary catheter with sterile water or saline. Option D, place the patient in the shock position and notify the surgeon. So here, indwelling catheter is in place and the patient is having 120 ml of voided urine after 6 hours. The drainage system has no obstruction. Then the intervention gets the priority will be evaluate patient circulation and vital signs. The rationale: a total urine output of 120 ml is too low. Assess the patient's circulation and hemodynamic stability for signs of hypovolemia. A fluid bolus may be required, but only after further nursing assessment and doctor's order. Question number 15. You are preparing for any catheterization of a trauma patient and you observe bleeding at the urethral meatus. Which action has priority? Option A, irrigate and clean the meatus before catheterize. B, check the discharge for occult blood before catheterize. C, heavily lubricate the catheter before catheterization. Option D, delay catheterization and notify the physician. The right answer is option D, delay catheterization and notify the physician. The rationale is bleeding at the urethral meatus is evidence that urethra is injured because catheterization can cause further harm. Then consult with the physician. Question number 16. What change indicate recovery in a patient with nephrotic syndrome? Option A, gain in body weight. B, decrease in blood pressure to normal. Option C, increase in serum lipid level. And D, disappearance of the protein from the urine. So in nephrotic syndrome, the finding of disappearance of protein from the urine indicates there is recovery. The rationale: with nephrotic syndrome, the glomerular basement membrane of the kidney becomes more porous, leading to loss of protein in the urine. As the patient recovers, less protein is found in the urine. Question number 17. Which statement correctly distinguishes renal failure from pre-renal failure? Option A. With pre-renal failure, vasoactive substances such as dopamine increases BP. With pre-renal failure, there is less response to such diuretics as furosemide. Option C. With pre-renal failure, an IV isotonic saline infusion increases urine output. Option D. With pre-renal failure, hemodialysis reduces the blood urea nitrogen level. So, which statement correctly distinguishes renal failure from pre-renal failure? The statement differentiating renal failure with pre-renal failure is option C. With pre-renal failure, an isotonic saline infusion increases urine output. Pre-renal failure is caused by such condition as hypovolemia that impairs the kidney perfusion. Giving isotonic fluid will improve the urine output. Vasoactive substances can increase blood pressure in both renal failure as well as pre-renal failures. Question number 18. Which criteria is required before a patient can be considered for continuous peritoneal dialysis? Option A. Patient must be hemodynamic, ally stable. Option B. The vascular access must be healed. Option C. The patient must be in a home setting, and D. Hemodialysis must have failed. The criteria required for the patient to have the continuous peritoneal dialysis would be option A. The patient must be hemodynamic alive stable. The rationale hemodynamic stability must be established before continuous peritoneal dialysis. That is very, very important. Question number 19. Polystyrene sulfonate, also commonly called as caxalate, is used in renal failure too. Option A. Correct acidosis. B. Reduce serum phosphate level. C. Exchange potassium for sodium. And D. Prevent constipation from sorbitol use. So caxalate is used in renal failure to exchange potassium for sodium. The rationale in renal failure, patient becomes hyperkalemic because they can't excrete potassium in the urine. Polystyrene sulfonate acts to excrete potassium by pulling potassium into the bowel and exchanging it for sodium. The 28th question. This is the 19th question. Your patient has complaints of severe right-sided flank pain, nausea, vomiting, and restlessness. He appears slightly pale and is diaphoretic. Vital signs are BP are 140 by 90 millimeter of mercury. Pulse rate was 118 beats per minute. Respiration is 33 breaths per minute, and temperature is 98.0 Fahrenheit. Which subjective data supports the diagnosis of renal calculi? Option A. Pain radiating to right upper quadrant. B. History of mild flu symptoms last week. C. Dark colored coffee ground emesis. D. Dark scanty urine output. So question, which subjective finding mentioned in the question supports diagnosis of renal calculi? So here the right answer will be option D, dark scanty urine output. The rationale is patient with renal calculi commonly have blood in the urine caused by stones passage through the urinary tract. The the urine appears dark, test positive for blood, and is typically scant. Now let's see the 20th question, but it is the 21st question of this video. Immunosuppression following kidney transplantation is continued. Option A for life, B 24 hours after transplantation, C is a week after transplantation, and days until the kidney is not rejected anymore. The right answer is option A. Immunosuppression in kidney transplantation patients should be continued for life. The rationale is immunosuppressants are drugs or medications that lowers the body's ability to reject or transplanted organ. When you get a kidney transplant, your body knows that the new kidney is a foreign, that is not originally part of your body. Your body will attack the new kidney and try to damage or destroy it. The immunosuppressant drug suppress your body's ability to do this. The goal is to adjust these drugs to prevent rejection and to minimize the way the side effect of this particular drug. Thanks for watching this video. Hope it is very useful for you. Please watch our channel continuously for getting more questions. If you like this two videos, please click and watch it. Thank you. Bye bye.